When were the latest clinical criteria for chronic fatigue updated? Have you ever wondered when the latest clinical criteria for chronic fatigue syndrome were updated? The most recognized criteria for this condition, also known as myalgic encephalomyelitis chronic fatigue syndrome, were last comprehensively updated in 2015. This update was conducted by the Institute of Medicine, which is now called the National Academy of Medicine. In this 2015 update, a new term was introduced: systemic exertion intolerance disease. This term highlights a key symptom known as post-exertional malaise. This symptom refers to the worsening of health after physical or mental exertion. The 2015 criteria focused on several core symptoms to aid in diagnosis. These include a significant reduction in the ability to engage in activities that a person could do before becoming ill. This reduction must last for more than 6 months and is accompanied by profound fatigue that does not improve with rest. Additionally, the criteria include experiencing post-exertional malaise, unrefreshing sleep, and at least one of the following: cognitive impairment or orthostatic intolerance. These guidelines aim to enhance diagnostic accuracy and improve clinical recognition compared to earlier definitions, like the 1990 for Fukuda criteria. Since the 2015 update, there have been ongoing research efforts and some proposals to refine these diagnostic criteria further. However, as of mid-0 to 5, no major updates have been universally accepted by leading health authorities such as the Centers for Disease Control and Prevention, the National Institutes of Health, or the World Health Organization. This means that the 2015 report from the Institute of Medicine remains the most current and widely accepted clinical framework for diagnosing this condition. For patients and advocacy groups, this 2015 update was significant as it emphasized post-exertional malaise as a central symptom. It also moved away from vague descriptions of fatigue. Nonetheless, some patients and researchers still call for further refinements to better reflect the complexity of the illness. To sum it up, the latest widely accepted clinical criteria for chronic fatigue syndrome were updated in 2015 by the Institute of Medicine. No newer official updates have been released by major health authorities as of 2025. Ongoing research may lead to future revisions, but for now, the clinical practice continues to relying on the 2015 criteria.